Okay, so this week we are talking about how pain doesn't live in the brain. And I think in the medical world, people often get labeled as making pain up, and we are talking about how that is in fact not true. What we know about pain is it is an indication of experience. It is not necessarily an indication of pathology or tissue damage. And so for our people who live in chronic or persistent pain, one of my favorite exercise is called a Psoas release, or in the yoga world, a supported bridge. And so you'll use a yoga block laying on the floor on your back, and it'll go underneath your hips. And I'll show you that in just a second. But I want to describe why I love the Psoas release. The psoas muscle is a very sympathetically driven muscle, very similar to the sternocleidomastoid in the front of the neck. And so in any case of a negative connotated experience, fear, anger, fatigue, pain, that sympathetic nervous system or your fight or flight is going to ramp up, and it's going to take the psoas and the sternocleidomastoid with it. And so one of the reasons I love this exercise is because it allows that psoas major to be put on slack over an extended period of time while we focus on diaphragmatic breathing to help massage the vagus nerve, or the primary parasympathetic neural input, our rest and digest, to help give the brain feedback that we are actually safe and that everything is okay. So I'm going to show you this exercise. You're going to place you're going to lay on your back, and you're going to place the yoga block directly underneath your hips. And you want that block right about the top of your gluteal cleft or your butt crack. Knees are going to stay bent and shins are parallel. From here, all we do is rest and breathe. And so the goal is to do a 365-degree breath where the ribs are expanding to the side and collapsing. Expanding to the side and collapsing. We're using that breath to help massage that vagus nerve. Nothing here should feel like a stretch, and if it feels too hard to get the block up that high, then you can always start with it on its lower end. What we don't want to see is a stretching of the legs, because people feel as though they're supposed to feel a stretch. In this position, we're trying to rotate the pelvis posteriorly to put the psoas on a little bit of slack and stay there while breathing, all to give the nervous system just a little bit of love and a sense of security. Typically, I recommend staying here about 5 minutes, but you can always stay here longer. As you come off of the block, you want to squeeze your glutes and lift your butt up a little bit as you pull that block out, and then place your hips back down. It might feel like a fair amount of pressure across the low back or the top of the hip bones, and you can do a little bit of pelvic rocking or let your knees fall side to side just to help work out some of that pressure. If you can't tolerate being there for 5 minutes, stop after a couple and try it again the next day. Let us know what you think of that. Leave comments down in the section, and feel free to subscribe for more updates.